Thank you very much. I was just start with showing you the cover of the first album that Elton John launched, produced, Empty Sky. It was in 1969, 50 years ago. And by coincidence, this guy, Sir Edward Mason, also described, let's say published, the first gastric bypass 50 years ago in 1969. And if you see here, the song, the Quite Well song from Elton John, I'm Still Standing After All Those Years, fantastic song at the end of the 80s, we can transpose that to the gastric bypass. It's just identically the same. It's still standing. We have a track record of more than 45 years in terms of publications. More than 1 million patients got the gastric bypass procedure. There is a very robust literature data. There is no way of any experimental surgery. Compare that with a lot of other procedures that have now been evolved and innovated. The results are well known, predictable, and are good to very good. I'm not going to say exceptionally good, but anyway, good to very good in terms of weight loss, in terms of improvement and disappearance of associated diseases, in terms of quality of life improvement, as well as gaining in the quantity of life. And by this, it acts as a reference to all other procedures that are published and are going to be innovated in the future. It has become also a safe and a standardized procedure, and not unimportant, it's still a reversal procedure because we actually don't remove any part of the organ. And if we look at a bit to, I would say, landmark publications that have been made, you can see here that very important publication by Walter Porras, who was saying, who would have thought it? An operation proved to be the most effective therapy for adult onset diabetes mellitus, dating from 1995, and also have been a very cutting edge paper. I have to say that it's not the first time that, diabetes and the relationship in doing a gastric resection have been noted. It's already 1955, you see Friedman, old paper where they mentioned doing a gastrectomy for ulcer disease, and that by coincidence they saw that there was already quite well diabetic control, and also in 1961 a Scandinavian study. This study is quite well known, this Tampere trial from Philip Schauer, 3 years outcome and 5 years outcome. You see a very strong effect of the gastric bypass and the sleeve gastrectomy in terms of having resolution of your diabetes in comparison with a intensive medical treatment. This is also a very important paper from Ted Adams, where he looked to the outcomes after 12 years, and that's a very long-term follow-up, where you see that there was a very good remission after 12 years, and also those patients who not had diabetes from the start of the study, the probability to develop diabetes was substantially less in the group of patients who got the gastric bypass versus the non-operated group of patients. And even more important, in 2007, Ted Adams published a very nice paper as well in the New England Journal of Medicine, long-term mortality after gastric bypass surgery. And you see that in the cause-specific regions of death, you see that regarding diabetes, there's a 92% less probability to die from diabetes in the group of patients who got the gastric bypass, which was an amazing result. Now, if you look a bit to the comparison bypass versus sleeve, already mentioned by Dr. Agrawal, you see that the two papers, nice papers, prospective randomized trial from, I think, Finland as well as from Swiss. You see there was no difference in terms of diabetic control, but they were a bit underpowered, as you said as well. So also that study here from Peterli, the Swiss study, doesn't show any major difference. But if you look a bit more in detail, I'll come to that in a second, you see that in a lot of other papers, as I mentioned, that the medication to keep the diabetes under control is substantially less needed in case of a gastric bypass than if you compare that with a sleeve gastrectomy, as also shown in the Tampere trial, both after 3 years as well as after 5 years. And this is a brand new publication in the Annals of Surgery from June, where they looked back again to the medication that was needed to get the diabetes under control. And you see that was based on an insurance database from the US, including more than 1,000 sleeve gastrectomy patients and 920 who had gastric bypass with a follow-up of 2 years. You see that indeed the group of patients who got the gastric bypass needed much less medication to get the diabetes under control. And another conclusion was for those who get the medication, the wide gastric bypass had an 86% lower total diabetes medication dose than those patients who got a sleeve gastrectomy. Just a bit of brand new publication. There's another paper that is a paper ahead in the Lancet, a prospective randomized trial from Scandinavian country, 109 patients as well. Also here, the same conclusion that seemingly the patients who got the gastric bypass needed much less medication than the sleeve gastrectomy patients. So, in a summary, just have 5 minutes. We are still keeping the gastric bypass as the number one operation to treat patients who have diabetes and morbid obesity. Thank you very much. Thank you.
Thank you.